Good evening, class. Our presentation today covers interesting facts pertaining to Medicaid and how it fits into the healthcare system. My name is Jared Kendell, along with my wonderful team member, Rylee Thueson. We will cover the process, how it works, how to apply enrollment, and qualifications needed. The scenario that was given goes like this. You have no way to pay for your medical care. You have heard that Medicaid may be the solution. Determine who to contact and where you go to apply for Medicaid. Medicaid is a federal and state program that helps low-income individuals and families pay for the cost associated with long-term medical and custodial care, provided they qualify. Largely funded by the federal government, Medicaid is administered by each state, and programs may vary. It also provides health coverage to millions of Americans today, including eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid is administered by states according to federal requirements. The program is funded jointly by states and the federal government. If you've heard of Medicaid, you've probably heard of CHIP. Medicaid and CHIP go hand in hand, working together to keep our kids covered. What is CHIP Medicaid? Well, in short, CHIP means Children's Health Insurance Program. It provides health coverage to eligible children through both Medicaid and separate CHIP programs. CHIP is administered by states according to federal requirements. The program is funded jointly by states and the federal government. Medicaid and CHIP both play a critical role in ensuring that children of dependent families have sufficient health coverage. Together, the two programs provide health care coverage to 1 in 3 children. Although they are both federal programs largely implemented through the states, with joint financing, the two programs differ in many respects. CHIP was created as part of the Balanced Budget Act of 1997 to build on Medicaid coverage for low-income children. States are able to utilize federal funds for CHIP to expand their Medicaid program or create a standalone program or a combination of both. The primary goal of CHIP is to expand the reach of government-funded healthcare coverage to more low-income children. As part of CHIP, the states have simplified the enrollment process, making it easier for children to obtain coverage. Although CHIP covers more children, its coverage options are more limited than Medicaid. The federal government matches state spending for both Medicaid and CHIP. To encourage more participation by states, the CHIP match rate is higher than the Medicaid match rate. On average, states receive 57% in matching funds for Medicaid spending, but they receive 70% for CHIP spending. However, under Medicaid, there are no preset limits or caps for federal matching funds. Under CHIP, funds are capped and states are limited to their specific allotment of funds. Enrollment. There are 2 distinct enrollment periods for health insurance, the enrollment period and the special enrollment period. Understanding the difference between the two is important, knowing which plans you can qualify for and when. The open enrollment period is the best time you can enroll in a government plan. These are the plans created by the Affordable Care Act. You cannot be denied acceptance to a government plan for pre-existing medical conditions. These plans also offer subsidiaries or discounts to your premium and costs, but only if you meet certain income requirements. For 2020 plans, the open enrollment period is from November 1st, 2019 to December 15th, 2019. You must enroll by the 15th of the current enrollment month for your coverage to start on the 1st of the upcoming month. For example, you need to enroll by December 15th, 2019 for your coverage to start January 1st, 2020. The special enrollment period basically begins after the open enrollment period ends. It is the time period outside of open enrollment. During this time, the only way to get a government plan is if you have certain life changes known as qualifying life events. If you miss open enrollment and do not have a qualifying life event, you could still get coverage through a non-government plan. These plans are a great and often inexpensive way to provide you with short-term coverage, specifically until the open enrollment period. How to apply. There are a few different ways. The first would be to go online where you fill out the application and then submit it. Second would be the mail-in method. This is where you would print the application and mail to the Medicaid office. The last method is a simple phone call to have someone assist you over the phone. When I was given the task to find out more information on how to enroll, I found it easiest to go to their website, www.healthcare.gov. Here are some screenshots of what I went through when enrolling. Essentially, you have to create an account. As you begin to create an account by providing a valid email address, it only takes a few seconds. You then need to answer a bunch of security questions going back to your emails inbox to obtain a password and authentication code. After your password, your Medicaid becomes active. You are ready to fill out the questionnaire enrolling for Medicaid.
There are a few terms that come up throughout the application process and on the Medicaid website that we felt the need to mention. Many of you may already know the definitions of these words,
but here's a little refresher for everyone.
CMS
stands for Centers for Medicare and Medicaid Services. It is a federal agency within the United States Department of Health and Human Services that administers the Medicare program and works in partnership with state governments to administer Medicaid, the State Children's Health Insurance Program, and Health Insurance Portability
Standards.
Then we have eligibility, which is fitness or suitability to be chosen, selected, or allowed to do something as defined by Webster. In Medicaid, there is financial eligibility, being below the federal poverty line, and non-financial eligibility, which includes age, pregnancy, resident, in-state you're applying to, U.S. citizens,
being a U.S. citizen or
and lawful residents of the U.S.
States, etc.
Next is benefits. The healthcare items or services covered under a health insurance plan is the definition of benefits. Covered benefits and excluded services are defined in the health insurance plan's coverage documents. In Medicaid or CHIP, covered benefits and excluded services are defined in state program rules.
Lastly is cost sharing. Sharing of costs covered by your
It is sharing of costs covered by your insurance that you pay from your own pocket. It includes deductibles, co-insurance, co-payments, etc. Cost sharing in Medicaid and CHIP also includes premiums.
As you can imagine,
the qualifications you must meet in order to be eligible for the program are very strict. They don't do this to be a pain. They do it to make sure that the integrity of the program is maintained.
You first must be at least one of the following. Be under the age of 19.
Be under the age
Be
of
pregnant.
19.
Be an adult with a child under 19.
Be an adult with a child under 19.
Be 65 or
Be
older.
65 or
Be
older.
blind or disabled in some other way according to the Social Security Administration
criteria.
Then, if you meet
one or more of the previous criteria we mentioned, you also must meet all of the following.
Be a citizen or legal immigrant
Be a citizen or legal immigrant to the United States, as well as be a resident of the state you are applying to receive Medicaid through. You then must verify that your income is less than the program limit according to your household size.
For example, if you are
a pregnant woman applying for Medicaid, and you are from a two-person household, you cannot make more than $1,944 a month. If you are applying to Medicaid to get coverage for your child who is under the age of 19 and have a five-person household, you cannot make more than $4,777 a month. Finally, any resources you may have access to cannot exceed the limits set by the program.
After going through the application process
and dissecting the many different qualifications, we have both determined whether or not we would personally qualify for the program. Being as my husband and I are currently both full-time students, I would qualify for Medicaid assistance at this time. In fact, I am currently enrolled in the program along with our daughter.
In fact, me and my daughter are
Jared, on the
currently
other
enrolled in the
hand,
program.
is a full-time employee and a
Jared
part-time student,
is a full-time
and he would
employee
not
and a
qualify
part-time
for
student and
Medicaid
would
at
not
this time
qualify for
because their
Medicaid at
household
this time
income exceeds the
because their
program
household
limits.
income exceeds the program limits.
Jared and I foresee many run-ins with Medicaid throughout our careers.
Jared and I foresee
These
many
programs
run-ins
are
with
not few
Medicaid
and far
throughout our
between.
future careers.
Around 75
These
million,
programs
million
are not few
people
and far
are enrolled in
between.
Medicaid,
Around
so we
75
imagine
million
it would
people
be
are enrolled in
hard to
Medicaid,
work in the
so we
healthcare
imagine
industry
it
without
would be
frequent
hard to work
encounters
in
with
the
it,
healthcare industry without
especially
frequent
because many
encounters with
healthcare
it.
facilities around the
Especially
nation
because many
accept
healthcare
CHIP and
facilities
Medicaid
around the nation
insurances.
accept CHIP and Medicaid
We
insurances.
think we will be very
We think we
impacted
will
by these
be
programs and
very
also be able
impacted
to
by these
witness any
programs
changes
and
that may
also be
occur
able to
within them in
witness
the
any
future.
changes that may occur within them in the future.
Now we'll talk about the successes and difficulties that we encountered.
Now we'll
The
talk
application
about
process
the
wasn't a walk
successes
in
and
the park,
difficulties
nor
that
very
we
fun, but it is
encountered
very
as
user-friendly
we
and easy to follow. They
applied.
provide many resources for you to reference if
The
you come
application
across any
process
difficulties,
wasn't
the main
necessarily a
one
walk
being their
in the
phone
park
number.
or very fun,
Jared
but
and I
it is
both
very
found success
user-friendly
in
and
the
easy to
application
follow.
process.
They provide many
The only
resources for you
thing
to
we can think
reference
of that
if you
was a
come
slight
across any
difficulty was the part
difficulties.
of the
Main
application where
one
they ask
is
about
being their
your
phone number.
employment and personal finances.
So some successes
That
we
portion of
found
the
were
application is very detailed and asks
it's easy to
for a
identify
lot
where
of
you can apply.
information,
It's a quick process,
and we think
and
it would
it's
be beneficial to
user-friendly.
have a strong understanding or gathering of
Only
all of your
difficulties that we
finance information and employer's information when going into the application
was the
process.
part of the application where they ask about your employment and personal finances. That portion of the application is very detailed and asks for very
Jared preferred to do the
detailed
application
information,
process via
and it
internet.
would definitely be
He said it was
beneficial
easy to
have a
create
strong
an
understanding
account,
of all
log
of your
in, and
finances
fill
and
out the
employer's
information needed.
information
It was
when
much
going
faster than
into
calling
the
a landline
application
and waiting for
process.
someone to answer the call or filling out paperwork and sending through snail mail. The website was easy to navigate and was self-explanatory, and he suggests that if you don't have the equipment,
internet, he said
or
it
we
was
suggest
easy
if
to
you don't
create
have
an account,
the equipment
log
like
in,
a computer
and
or
fill out the
printer to fill out the
information needed.
application or get it
It was
printed,
much faster than
to do the
calling a landline
application
and waiting for
process
someone
over
to
the
answer
phone.
the call or filling out
If you
paperwork
do
and
have the
sending
tools to
it
complete it
through the
online
mail.
or by mail-in,
The
we would
website
suggest
was
doing it
easy
that
to
way.
navigate and was
It would be
self-explanatory.
beneficial to have
We suggest
your finance
that if you don't have the
information
equipment,
on hand, like we had
or we
mentioned
suggest that if you
previously,
don't have the
before you
equipment,
begin the application
like a
process.
computer or printer to fill out the application or to get it
Call
printed,
their number
to do the
if you have any
process
questions,
over the
and know
phone.
that
I
it is worth it when you are done with the
called
application
Medicaid
process.
as I was doing some research and asked some
I called
questions
in
about
the
that
Medicaid
process,
office
and they
when I was
said
doing my research
they
and talked to somebody about
typically will encourage you to
the
apply
phone version of applying,
on
and
your
they
own
said
via
that
internet or
if
sending
you
it in
call
through
in
the
wanting
mail,
to
but if
apply
you
over the
have
phone, they will
any
encourage you
hindrances that would
to
not allow you to do so, that they are willing
try
to
and
help
do
you,
it on
and
on your own.
that process over the
But
phone
if you
can
don't
take
have the
quite a
means
bit of
to,
time
or
because they
have
have
some
to ask
impairment that hinders
several
you the
questions
ability
as
to
well
do
as,
so, that they are
just
willing to
like
help
me,
you.
have to fill it out
The
online.
process is still pretty tedious and can take quite a bit of time, though,
And
even when doing it
just
over
take
the phone.
advantage of all of the tools
We
that they
have
give
come
you,
up with a
especially
few
their phone
questions for you
number.
guys to ponder going into our discussion board.
Just know that
Feel free to
it is
answer
worth
one
it
or
when you're
all of
done with the
them,
application
and please
process.
share any other thoughts, knowledge, or experiences that you feel prompted to.
All right.
We look forward to discussing Medicaid and CHIP in greater detail with all of you throughout the week.
To participate in the discussion board, and we look forward to hearing from you guys and your thoughts on Medicaid and CHIP programs.